1979, Margaret Thatcher was elected Prime Minister, and for the first time, NHS contracts were outsourced to private companies. The first outsourced were kitchen and cleaning services. Ministers forced hospitals to accept these contractors despite pillowcases and bedsheets often coming back below the required standard. Initially, the NHS could cancel contracts with providers if they weren't good enough. However, the private companies weren't happy about this, and they piled pressure on Health Minister Kenneth Clarke, who authorised a telephone directive to all health authorities, changing the rules in the contractor's favour. Under the new instructions, no health authority could decide to throw out a contractor, no matter how bad their performance, without Prime Ministry approval. This all led to a disastrous drop in hygiene standards that created ideal conditions for the spread of a new superbug, MRSA. Thatcher also introduced the National Health Service and Community Care Act. This involved breaking up NHS hospitals. Many became trusts, which they remain today. This means they operate independently rather than together and compete with each other for funding. Thatcher claimed this was done to increase efficiency and eliminate waste through competition. However, the Hillingdon Health Emergency said this of Thatcher's reforms. The evidence indicates that privatisation costs money rather than saves it, and standards fall drastically. Privatisation is a political move to line contractors' pockets and destroy the power of organised labour. In 1990, John Major became Prime Minister.
It's a very exciting thing to become leader of the Conservative Party.
The outsourcing of NHS contracts continued, and Major founded the first PFIs, or Private Finance Initiatives. A PFI is a way of financing public sector projects through the private sector. A private company handles the upfront costs, and the government authority makes payments to the private company over the long term. PFIs became relevant to the NHS under the next government. In 1997, Tony Blair was elected Prime Minister. He hired Alan Milburn as Health Secretary, and for the first time, NHS medical services were outsourced to private companies. Smashing 50 years of ideological hostility towards private medicine, Health Minister Alan Milburn agreed a historic concordat with Britain's private health industry. There was pushback from NHS workers and unions alike, but Blair and Milburn pushed ahead. They also took John Major's PFI scheme and signed deals for multiple new hospitals, which was a short-term win. The advantage for the Treasury is infrastructure projects are kept off the balance sheet. Despite more resistance from trade unions, they again went ahead. Milburn exclaimed, "It's PFI or bust." However, the contracts heavily favoured the private companies. Under the PFI contracts, the NHS trusts, not the private companies, bear the risk of high inflation, which means the payments to PFI companies may increase substantially as the retail price index rises. In short, expenditure on staff, equipment, and other capital projects can be cut by a trust, but not their PFI payments. And in 2011, it was reported by the Daily Mail, as part of the deals, hospitals had to sign contracts under which they agreed to pay hyperinflated prices for maintenance work, meaning hospitals are being forced to shell out £242 just to change a padlock and £13,704 to install 3 lights. By 2018, the interest was so high that some hospitals can't even afford to buy sutures to stitch up wounds, and other hospitals are spending more on PFI debt than they are on drugs. Alan Milburn stood down as an MP in 2010 and now runs a business, and it was reported in 2022 alone, Milburn and his immediate family raked in $2.1 million from his consultancy firm, with some of the money coming from firms profiting from his health reforms.
Sometimes I feel it's unfair if people think literally Iraq is all there is. I mean, there are many other things that we did.
Blair also outsourced NHS medical services and committed the NHS to multiple multi-billion-pound PFI deals. Yet he is still pushing for further privatisation. In 2010, David Cameron was elected Prime Minister, and in 2012 he hired Jeremy Hunt as Health Secretary. The NHS was dramatically altered under Hunt's 6-year tenure as outsourcing of NHS contracts to private companies grew substantially.
I don't want to be privatised either.
Carillion were one of the biggest winners of NHS contracts. In 2013, a facility owned by Carillion called Clinicentre in Stevenage was bought back by the NHS after 3 routine surgeries resulted in death.
I believe very firmly that Carillion should have their licence to operate healthcare in the UK suspended.
Yet, despite Stephen McPartland's plea, Hunt awarded Carillion with more NHS contracts, including major PFI schemes at Royal Liverpool Hospital and Midland Metropolitan Hospital. It was only when Carillion itself collapsed in 2018 that the government put an indefinite halt to starting any new PFIs.
Leaving the nation with a bill of more than £200 billion to pay off.
It was reported by The Guardian that civil servants working for Jeremy Hunt successfully lobbied the Cabinet Office to stop failing Carillion hospital projects from being overseen by an independent watchdog. Hunt also cut NHS funding. The Office of Budget and Responsibility claim that an increase of funding of around 4.3% is needed each year for the NHS to keep up with inflation. Yet year on year, Hunt only increased funding by around 1%. Open Democracy called this a historically low funding period for the NHS. This trend of underfunding the NHS continues today. In 2022 alone, the real term cuts were between £4 and £9.4 billion.
Conditions that we give the care in are not suitable. Not now, not ever.
However, Hunt's tenure is most famous for his work war on junior doctors. In 2015, he imposed new contracts on junior doctors by slashing overtime pay that would be facing a pay cut of up to 40%. Hunt denied this initially.
Well, this is the result, I'm afraid, of a very regrettable campaign of misinformation by the BMA, suggesting they were going to have big pay cuts.
But he later admitted if they work over 56 hours a week, which is a common occurrence, then they will actually have their pay cut. For the first time in 40 years, in 2016, industrial action was taken after 98% of junior doctors voted to strike, and they did so on 3 separate occasions. Hunt refused to negotiate with junior doctors or trade unions. Many junior doctors and other workers left the NHS under Hunt, including nurses, whose pay stagnated for years. Before Hunt left office, there was a nursing vacancy of 11.8%. Nurses and other NHS workers' pay has fallen dramatically over the years, resulting in over 25% of NHS trusts needing to operate food banks for their staff. Today, the NHS is understaffed by 10%. With long working hours and high anxiety driving more staff to quit. The lack of staff and funding the NHS received resulted in an increase in black alerts, meaning hospitals were unable to guarantee life-saving emergency care and had to divert patients to other hospitals. Hunt's fix was to ban hospitals from using the term black alert. When he left office in 2018, he stated that reports of privatisation were fake news. Although a few years before he was Health Secretary in 2005, he co-authored a book titled Direct Democracy, which heavily promoted the privatisation of the NHS. If Hunt still held those opinions when he took on the role of Health Secretary, then outsourcing contracts, underfunding and decimating the workforce of the NHS would be good places to start.
So we'll have a new Prime Minister in that building behind me by Wednesday evening.
Since David Cameron left office, there has been 4 Prime Ministers and 5 Health Secretaries. Yet the way the NHS is being operated is much the same. Boris Johnson hired Matt Hancock, who was involved in multiple scandals, including awarding a pest control company £350 million in contracts via the VIP lane to supply PPE. Later, they were ordered to repay £70 million for providing equipment unfit for purpose. Hancock was also criticised for breaking ministerial code when he appeared in a newspaper advertising private health firm Babylon, who had previously donated £10,000 to the Tory party. He personally received £32,000 from the Institute of Economic Affairs, yet their head of health and welfare, Kieran Nemitz, has stated opponents of NHS privatisation are really opposed to patient choice. In 2019, Hancock himself stated, "There is no privatisation of the NHS, not on my watch." Although the same year, £9 billion of the NHS budget was outsourced, which was an unprecedented level. Under Rishi Sunak, before Victoria Atkins, Sajid Javid was Health Secretary, and in 2021 it was revealed he had shares in private health firms, although he sold them after this was reported. Then, in 2022, he wrote, "Health insurance should be considered to help pay for the NHS," although he will be standing down as an MP before the next general election. We are seeing more and more stories from MPs advocating for an insurance-based system now, including from former Shadow Health Secretary David Davis, who in the past has directly profited from a private health insurance firm. Both David Davis and Sajid Javid appear on a list of 70 MPs who were reported to have links to the private health industry back in 2014. This list also included Jeremy Hunt. It was reported in 2024 that a large number of Labour MPs are taking money from donors linked to private health firms, including Shadow Health Secretary Wes Streeting and leader of the Labour Party, Keir Starmer. An example of the insurance-based system in action is in America.
In tonight's Health Watch, we will take a look at the growing crisis of medical debt in America.
A heart condition left him with massive debt despite having health insurance.
While some denials come with specific justifications, most explanations are vague.
Medical expenses is now the #1 cause of personal bankruptcy.
In the US, the average cost of childbirth with health insurance is between £2,000 to £2,500, and without it, the average is around £14,700. So if they don't pay out, you can expect a hefty hospital bill. Ambulance call-out costs an average of £1,600, and the average total cost of cancer treatment is £117,000. But it can cost much more. In 2024, the Forbes Advisor provided advice on health insurance for Americans. Like car insurance, there are varying types of coverage you can shop for, and the price will be determined by an algorithm. However, they also posted a list of the average monthly cost by age, and a 21-year-old will pay around £308 a month, and this increases as you get older, meaning a 60-year-old paid just over £800 a month on average. Despite what MPs might claim, there's no reason to think this would be different in the UK, as it would be the same companies operating here. Some of them already do. In February 2024, an Oxford University review concluded, privatisation is linked to worse patient care. They make higher profits achieved by reducing staff levels, including fewer cleaning staff, resulting in higher rates of patient infections. And some studies showed higher levels of hospital privatisation corresponded with higher rates of avoidable death. And no studies included in the review finding unequivocally positive effects on health outcomes. The conclusion is simple. Private healthcare businesses exist to make a profit, and the NHS exists to keep you healthy.